So ionizing radiation is those beams of rays that come out of a source under the table that penetrate tissue, provide contrast of the tissue, and give us images of tissue.
We can define disease, we can treat disease, and that's led to the development of a whole new type of medical specialty, which we call percutaneous procedures, and that just means through the skin.
Subsequently, it was learned that radiation was dangerous. It caused tissue damage, it caused changes in growth cells, and a number of other pathologic conditions.
I think the best way to conceptualize what radiation does is to think of radiation as energy. We call it ionizing radiation, and that means there's a charged ion, and that charged ion is looking for something to react with. And again, if we think of the principles of attenuation, it's going to charge towards whatever particle it encounters, and it'll either stop dead if it's a dense particle, or it'll pass through. And then if it hits that particle and reacts with it, there's actually three possible reactions from that. First of all, the body that it can actually result in cell death. It can result in cell mutation, in which the DNA structure of the cell ends up in something called double-stranded DNA breaks, and that means actually the ability of the cell to accurately program proteins is impaired. Or it can lead to a sort of halfway house, which is called cell senescence, and it basically means the cell is injured and it sends out distress signals, and those distress signals can result in chronic inflammation. And chronic inflammation basically is behind every chronic disease process, from coronary artery disease to diabetes to all forms of cancer.
So a very busy interventional cardiologist over the course of their lifetime may get as much as 50,000 chest x-rays exposure to their head. If you look at nuclear power plants, or an interventional cardiologist, the average interventional nuclear cardiologist will get probably 3 to 5 times the radiation exposure of a nuclear power plant worker.
I don't think any interventional cardiologist doesn't sometimes at night lean back and think about what would happen if they get a glioblastoma of the brain. That's, I would say, every interventional cardiologist's fear.
The guy who was my chief of cardiology, Dr. Pat Scanlon, got a glioblastoma at age 63. There's a higher incidence of glioblastomas. Some work done in Italy because our left side of our brain is exposed to more stuff, just like my left polyp. I was diagnosed with prostate cancer in 2018. A year later, in 2019, I was diagnosed with lymphoma. I couldn't breathe through my nose when I was running on the treadmill. It was just my left nose.
I sort of looked in the mirror one day and thought, there's a bit of a spot on my nose. And I thought, well, it's just a spot. Then I got a call to say, actually, you've got a highly malignant, highly invasive basal cell carcinoma with very nasty features, and you're going to need to have it operated on. So I thought, well, okay, it's a tiny little thing. I thought it was just going to be a bit of a scoop out. And then they sort of rather reluctantly came back to me and said, I'm really sorry, but actually we're going to have to take a lot more out. All of the side of my nose had been just chopped out. And they chopped away all the skin, and there was just this very, very thin layer of cartilage, white, bright white. And I looked in the mirror and I thought, what the fuck?
So I saw oncologist, went through all the routine stuff of a spinal tap and a bone marrow and PET scans and MRIs and CAT scans. That eventually led to chemotherapy.
It's probably going to take a number of weeks to heal up with daily dressings. I then had a period of time where I was sort of trying to put the dressings on, but these were very specialist types of dressing, and I didn't really have the knowledge about how to do this. And so the only people I could get to help with the dressings were the people my friends, who were an oculoplastic surgeon and a pediatric cardiothoracic surgeon. So I went round to them pretty much every day, and they did all the very fine dressings. Sorry. I haven't really spoken about it like this. But it was You can see, it was a really difficult time. By that stage, I had sort of decided I was going to give up cardiology.
He left being director of the lab. Person was then director of the lab, Allie Johnson, had a appendiceal mucinous carcinoma. Probably had 10 to 15 surgeries and chemo almost every month for about 10 years. She passed away last year. Another partner had thyroid cancer. The thyroid is vulnerable to radiation as well. Another partner had a left carotid dissection, Dr. Tim Larkin, which is related to radiation. Another partner, Lou McKeever, had metastatic colon cancer at the age of 50 with liver mets. Had a recurrence a year later, lived, and then died of Lewy body dementia just this year. And Joe Hartman is a friend of mine, partner, one of my mentors, as well as Lou. And he died within 6 months of diagnosis, diffuse histiocytoma. Other people that I know that have had the pleasure to work with, Jeff Hartzer had prostate cancer and died in his 60s. Don Boehm, famous interventionist from Massachusetts, ended up with an adrenal carcinoma. And I say their names because I want people in the audience to know it could be you. These are not just nameless faces. These are phenomenal physicians who, just like you, were trying to take care of patients.
Radiation is a silent killer. People who are exposed don't feel it, they don't know it, they're often unaware of it. It may not appear for a time. I mean, acutely it may not appear for weeks. Chronically, it could appear later in the year or years. It may manifest as a tumor, cancer, or other things.
One of the things I reflected on is I had been sort of idiotic with my use of radiation. I was safe, I was careful, I knew about it, but I wanted to make others much more aware so they're safer.
I was kind of aware. I would take the appropriate precautions that we're all guided to do. I'd be wearing my leads, we have the radiation badges, but you never think it's going to happen to you.
Are you scared of radiation?
No. It doesn't affect me now, which is the short-sighted thing to say, but I feel like I know the risk exists. I'm not going to not do interventional cardiology, and all I can do and all I am doing is maximize my own protection.
We're programmed in a strange way to react to the acute threat. Everything that we do in terms of disease process and behavior is programmed from an evolutionary perspective.
The administrators look upon it as a cost to simply keep a person protected from getting radiation to one day either have a major orthopedic injury, a spine injury, a knee, a hip, or cancer. And literally, they'll say, oh, we can't afford it. The insanity of saying you would not do everything humanly possible to protect healthcare workers is nuts.
I don't think I should be making those choices. It's my health or the patient's health.
I'm angry with hospitals that deny the fact that we are at increased risk and that actually we're dismissed in a way, and that if you have a problem it's because you haven't been wearing your protection. But it's fine. I mean, I can't wear a lead shield on my face. That's why systems which cut down scatter, I think, are going to be important.